I'd like to talk today about what dental implants are. Dental implants today are becoming a quite common treatment being done in dental offices. Um, Back in the day when we're missing teeth, the only option to replace a tooth would really be to do a bridge or to do some dentures. And dental implants have come into play, um, which have great advantages over doing bridges. Now, I'd like to first of all talk about, we'll kind of revisit what a bridge is and what are the disadvantages of a bridge, and then we'll kind of bring dental implants in and we'll discuss what the great advantages are for dental implants. Coming to my tablet, I'm going to draw the back molar. And just for info, okay, we're looking at a lower left molar at the back. We got a missing molar in between, and then we have a premolar in front of that. And let's draw in the gum as well. So here's our gum tissue here. There's our gum. And beneath our gum is our bone. So let's do our bone in blue there. So here's our bone. So I'm going to put my X's there. That means there's bone there. And our bone, within our bone, the roots of the teeth, which are from here to here, these are the roots. The roots are within the bone. The bone acts as a foundation to hold our teeth in place. And you can imagine when we're missing a tooth, this foundation will start to shrink. So the bone will actually start to fall. It'll start to shrink down. And this is a great disadvantage because when the bone starts to shrink, then the teeth as well will start to shrink as well and will start to drift. And they can start to drift, they can start to move. And this can have an overall impact on the functioning of our teeth. Even with the shrinkage of the bone, it can have an impact on the facial appearance. So a bridge, ultimately a bridge is a cap that's going to cover the back tooth and a cap that's going to cover the front tooth. And both are going to hold an artificial tooth. So let's come in. I'm going to draw the bridge in there. So here we go. Here's a cap that's going to come on top of here. And here we go. Here's a cap that's going to come on top of there. And it's between these caps where an artificial tooth is going to be connected. So a bridge would be all one piece and it would be actually glued right on top of this whole span. Now a disadvantage here would be that, well, how are we going to floss? We can't floss in between here because it's all connected. So the only way to floss would be to feed some floss underneath this bridge, which is which is a little difficult to do. And if we're not diligent with flossing, we could end up with decay or cavities underneath the bridge. And ultimately, if the bridge fails, we risk losing more teeth. Okay, now coming back to the implants, let's draw our molar again, our back molar. Here's our molar, and here's our missing molar, and then here's a premolar in front of that. And let's put the gum in. That'll be red. There's our gum tissue. And underneath our gum, let's get our bone. So those are the little X's. So our bone, as I had mentioned before, our bone is the foundation that holds all of our teeth in place. And if the bone starts to shrink or fall, then the foundation gets weak, and that's when we end up losing teeth. And if we're already missing a tooth, the bone will start to shrink. So an implant is a titanium screw. And let me draw that in. So it's kind of looks like a root. If you look at the shape of the roots of the teeth, an implant kind of mimics the appearance of a root, and really it is kind of acting as a root per se. So the implant is placed in the bone, and the great advantage now of an implant, once it's healed and the bone has joined with the implant, the great advantage is that it is going to keep the bone. It's going to keep it at that level. So it'll help to prevent the bone from shrinking. So it actually preserves the height of the bone. And in addition to that, not only preserving the height of the bone, an implant will help by preserving the bone. It's preserving the strength of the adjacent teeth as well. So once the implant is healed, then a tooth can be placed on top of the implant. And virtually once the tooth is placed on top, it is pretty much like a whole brand new tooth. And another great advantage you can see here is that, look, where I'm drawing the arrows, we can floss. We can floss in between, and we can keep the area nice and clean without having to fiddle with floss threaders and trying to get under that bridge to keep it clean. Now you can floss this tooth as if it were your own natural tooth. So we can keep it clean. It provides support now. It's providing great support for the adjacent teeth. And all in all, your overall function now has been preserved. So coming over here again, so we're talking about advantages of your implants. And the first advantage would be that we are preserving the bone. The second advantage would be that we're not weakening the structure on the adjacent teeth. We don't have to touch the adjacent teeth at all when we're doing an implant. And the third option would be that we're all in all, we're restoring function. We're restoring function back again. And our fourth advantage would be that we are making it easy to keep clean. So we can keep the area nice and clean, which is a great advantage over doing a bridge. So all in all, you can see by putting an implant in, we have provided you with a much better functionality in the mouth and an overall better oral health, which means better health overall. So in conclusion, implants are really the best option. They're just like your own teeth.